I draw a picture in my mind. It fills a point in space. The goal rides high on passion.
Well, here's something scary to think about. Did you know that half of all people who have heart attacks never show any symptoms before it happens? And most of us too busy to get tested?
Okay, we just brought this party to a complete halt.
I'm sorry. We're
right.
falling in love with our bosses,
yeah,
and now
we
we're
are.
having heart attacks.
Brad Scott. Anyway, we're going to talk about these tests and what would happen if maybe you were able to get one. We're going to show you how they could change your life, maybe save your life, save some time, and save a lot of money. It's the Heart Bus.
Did you realize, Kaylee, that 1 in 3 people have some form of heart disease, and most don't even know it? And a lot of us can be too busy to go get things checked out. And this is going to help greatly. This is the Scottsdale HealthFair Heart Bus, and it will come to you. We have on board this morning Dr. Kevin Clausen, the Medical Director for Cardiology Services at Scottsdale HealthCare. Good morning, Dr. Clausen. Good to see you. This costs $179 to get tests that might cost around $3,000 at a hospital. Is that correct?
That's absolutely correct. Cardiovascular disease is incredibly common and associated with strokes and heart attacks. There's a lot of things that patients can do to help prevent these things from happening to them, including coming to have this type of screening.
All right, well, we have a patient over here, and his name is Larry Covey. It's kind of a tight squeeze, so why don't you go past us, Dr. Clausen, and good morning. How you doing?
I'm doing fine now.
Well, good to hear that. Go ahead, Bob. You go first, since it's a tight squeeze, and you get in there. What did they find out with you, sir?
Well, they found that I had a problem with my aortic aneurysm, the thoracic, and they had to, they recommended that I go over to the heart hospital or to a cardiologist and have it looked at to see what the problem was.
Because it was a quick and painless screen, they were able to find that he had a significant and potentially very serious dilatation of his aorta. It led to surgery, and Larry looks terrific today.
Oh, that's awesome.
We talked earlier, though, that a lot of patients don't necessarily know that there might be a problem early on. So how do you get people into a bus like this to actually get tested?
It's difficult. People are busy. They don't want to make time for it, but it's extremely important. Cardiovascular disease is incredibly common. Aneurysms, carotid disease, coronary disease, smoking. There are a lot of things that are going to accelerate disease, and a lot of times if you can find these ahead of time, you have a great outcome like Larry did.
Well, Larry, why don't you lay down there, and the doctor's going to show us how this works.
Okay.
Is there a certain age when you need to really start getting checked out, you think? Or
Pretty much everybody like me who's middle-aged and older is going to be at increased risk. Other people who are at much higher risk are smokers, people with high cholesterol, diabetes, high blood pressure. Absolutely. Good point. If your mom, dad, brothers, sisters have had a heart attack before age 65, they're going to be at higher risk.
All right,
we want to take some of the intimidation out of this so that you guys can see exactly what Larry is going through. This is what you'll go through if you come and visit the Heart Bus. Dr. Clausen, can you kind of show what's happening here?
Sure. She's placing a transducer on his neck, which allows us to visualize his carotid arterial flow through the carotid, that is. And we're going to be looking for plaque. That's a buildup of cholesterol and calcium that, if it gets serious enough, high grade enough, it can lead to a stroke. So we screen for this, and if we find evidence of high-grade disease, we refer him for further studies. And if there's only mild disease, then we talk about cholesterol management, blood pressure management, and absolutely smoking cessation.
And you said this test takes about 15 minutes? That's amazing. In 15 minutes, you can determine whether somebody needs surgery or not.
It's quick and painless, and it's incredibly useful.
Wow. And then what are the other things that you can test for on this bus?
They can scan your belly looking for an aneurysm, a swelling of the aorta. They can scan your heart looking to see how well the heart pumps and if the valves work well. They can also do blood tests, screening for diabetes, for cholesterol, things of that nature.
And it only takes about an hour, so no excuses.
No, it's quick and it's easy if you make the time for it.
Now let me ask you, if you go get tested this year, when do you need to get retested?
Probably, if your results are good, probably just every few years with your regular physician would be plenty.
All right.
This is more just to kind of get you in the mindset that you're predisposed to vascular disease, and there's a lot that you can do to help prevent it.
And from now until the end of the month, you guys are going to be all over the valley. Places like Cave Creek, Mesa, Paradise Valley, Scottsdale, Tempe. Okay, that's great to know.
You like working out of a bus?
Love it.
Little tight, but not bad.
Yeah.
That's
well,
great.
Listen, thank you guys for bringing this down. This is quite the operation, but it's very important, as you pointed out.
Thank you hugely for having us.
It's a tight squeeze for our camera.
Yeah.
Bob's only about 6'3", so getting him to move around here with his camera on his shoulder is not easy, but thank you again. Larry, we're glad you're around.
Doing great.
Yeah, me too.
Yeah, he is.
Good color to that skin over there. All right, we're going to take a quick break around here, but have you noticed some of the flowers in the state of Arizona these days?
Yeah.
Really is beautiful. So